Valeant Pharmaceuticals cleaning house, making sweeping changes to its board after outgoing CEO Michael Pearson and activist investor Bill Ackman were grilled on Capitol Hill. Lawmakers accusing Valeant of hiking prices and gouging patients to reward investors.
But we have also made mistakes, including those that bring me here today. In particular, Valeant was too aggressive, and I, as its leader, was also too aggressive in increasing the prices of some of our drugs in our large portfolio of products. In hindsight, I regret pursuing transactions where the central premise was based on an increase in price.
Joining us now with more on the Valeant hearing and drug prices, the chair of the Aging Committee, Senator Susan Collins from Maine. Senator, it's great to see you and welcome.
Thank you.
I wish it was an absolutely free market, because that would make no sense if there were competing drugs for what Valeant had. That's how the marketplace takes care of itself. And I know you know full well we don't want to curb innovation at companies that are truly trying to do the right thing and recoup their investment on maybe diseases that aren't that prevalent. It's a quagmire trying to get this regulatory system correct, and I'm sure you know that. But what have you learned in the last couple of days?
Well, first of all, let me address your comments about it being a free market. We give special privileges to pharmaceutical companies to reward them for that investment that we want them to undertake to produce new drugs, life-saving medications. That's why we give them exclusive rights under our patent laws for a number of years. But that's not what happened here. In each of the 4 cases that we examined, Valeant had absolutely nothing to do with the R&D that developed these drugs. Instead, it identified monopoly drugs for which there were no good generic competitors, bought those drugs, and then raised the prices by some cases as much as 4,000%. So it wasn't as if they'd spent money on the research and development. It wasn't as if their manufacturing costs had soared. They had remained the same. It was simply that they saw an opportunity with a captive audience of patients that needed these drugs to jack the prices through the roof.
Yeah, there are bad actors, that's for sure. It's unfortunately, you need to separate the bad actors from the companies that don't operate that way. But even the major pharmaceuticals have been known to spend a lot of money on extended release versions to extend, patent protection, and what money that could have gone into R&D goes into marketing or developing these Me Too. So, like I say, it's a quagmire. You can't paint a broad brush the whole industry, but then again, it's not just Valeant and what's that other one? Turing or whatever. I mean, those are one-offs, obviously, and I hate to see it just, politicians demagogue it and say it's the entire pharmaceutical industry, but then again, nobody's completely guilt-free.
Well, none of us have demagogued this issue. We've gone out of
You're
our
a Republican.
We've gone out of our way to acknowledge the fact that we do need incentives for the pharmaceutical companies that are engaged in high-risk research. Most of the drugs that they're developing will never make it to market.
Right.
It can cost more than $1 billion to bring a drug successfully to market, but that's not going on with these companies that aren't doing R&D. Their R&D percentage is minuscule, or in some cases, is non-existent. They're taking advantage of decades-old drugs that have been around for years, and they're buying them and then jacking up the prices simply because they can. Right. And that's why we need to look at the FDA process on how
Senator,
we can produce more.
Real quick, your impression of Bill Ackman and the hedge fund community and investors in companies like Valeant.
Well, many of these companies act more like hedge funds than traditional pharmaceutical companies. Right. I'm going to take Mr. Ackman at his word. He promised that he would bring the board together today to discuss the drug pricing, and I'm very pleased that our hearing has had that effect.
Senator Collins, thank you so much joining us this morning right after those hearings.